Hello everyone, we'll learn the regulation of heart rate today. So the objectives for today will be autonomic regulation of heart rate, meaning at the end of the session, you should be able to explain or describe the regulation of heart rate under autonomic regulation or reflex regulation, neural regulation, regulation by higher centers, humoral regulation, and also the effect of ions and temperature. So to introduce you to the topic, we know that the heart rate normally is due to the rate of discharge of SA node. Of course, the AB node, the Purkinje fibers and ventricles also have the capability of autorhythmicity. But normally, when SA node is functioning, and in the normal heart, it is SA node which is taking over for the rate of discharge, hence the heart rate. Hence, we call SA node as the pacemaker of the heart, as it has the fastest spontaneous rate of depolarization to threshold. So whenever SAN, that is the sinoatrial node, reaches its threshold, an action potential is initiated that spreads through the heart to contract. So if the SA node is the one which is providing the heart rate, then the normal range would be 60 to 100 beats per minute. Of course, when AV node is promoting, it would be lesser. Likewise, the Purkinje fibers, the ventricles, whenever they take their autorhythmicity, the heart rate goes on decreasing. But at the sinoatrial rhythm, the normal range is 60 to 100 beats per minute. So when according to the increase or the decrease in heart rate, which is called bradycardia and tachycardia. So we call them the physiological, and the bradycardia and tachycardia can be either physiological or pathological. So physiological variations could be either due to the age, the gender, the diurnal variations, the respiration, the body and environmental temperature, the food intake, the alteration in posture, that is from sitting to standing, supine to standing. All these would affect the heart rate, and of course exercise also. So we can explain it with respect to the tachycardia and the bradycardia, isn't it? So when we say the tachycardia, when we say the tachycardia, there will be increase in the heart rate, which is greater than 100 beats per minute, and that can happen either physiologically or pathologically. So in physiologically, where do we see tachycardia? We see it in following exercise, isn't it? And also pathologically, we can see tachycardia in fever or in anemia. Likewise, bradycardia, when does the heart rate decrease to lesser than 60 beats per minute? That can happen also in hypothyroidism, that is whenever the thyroid gland is not functioning properly. Okay, and physiologically, when can it happen? It can happen in old age and also in people who are more into meditation and pranayama. So these are the physiological and pathological variations in heart rate, which are called either bradycardia or tachycardia. So how can we control this heart rate? We can control the heart rate based on multiple things. That is, there are multiple things which will be controlling the heart rate. Like, for example, first thing is about the higher centers that which are situated in the pons and medulla. Okay. And then there are right atrial volume receptors, there are chemoreceptors, there is hypoxia, which will affect, there is hypercapnia, painful stimuli, the body temperature, inspiratory center, and other higher centers like hypothalamus, the cortex, the motor sensory cortex. All these are going to affect the heart rate. Now, how? How are all these going to affect the heart rate is our primary concern. So let us study the actual regulation of heart rate. So you know that heart rate can be regulated either through the neural mechanisms or through the humoral mechanisms, isn't it? So firstly, let us learn the neural control mechanisms. So the neural control can be further classified as autonomic regulation, the reflex regulation, and regulation by higher centers. So when we talk about the autonomic regulation of heart rate, So autonomic, from the name, what do you understand? It is the autonomic nervous system, which is sympathetics and parasympathetics. So as we know that SA node is the pacemaker of the heart, and that is the one which maintains the normal heart rate. We know that SA node is under the influence of autonomic nervous system, which is either both sympathetics and parasympathetics. Under this influence, the normal range is being maintained to be 60 to 100 beats per minute. Now, this autonomic nervous system, which innervates the heart, can modify the rate, the strength of contraction. So, you know that SA node has got autorhythmicity, meaning it can provide the heart rate even under the non-influence of autonomic nervous system. But under the influence of autonomic nervous system, there can be modification of heart rate. So under that, we can study the parasympathetics and sympathetics. Now from this you understand the parasympathetics that supply to the SA node and AV node, and so you can see here parasympathetics to heart is coming through vagus. So the vagus will supply the SA node and the AV node and few fibers to the atria. And then you see the sympathetics. Sympathetics arise from T1 to T4 segments of intermediolateral horn, and they supply, you can see here, they supply the SA node, they supply the AV node, they supply the ventricular muscle fibers also. So this difference is what you need to learn here, that the AV, that is the parasympathetics do not have any control over the ventricular muscle fibers and hence contractility of the heart. That is, the contractile ability of the ventricular muscles is not under the control of parasympathetics but under sympathetics. Whereas the rhythmicity, that is the heart rate, is under the control of both sympathetics and parasympathetics. So if you can see here, you know that the parasympathetics is arising from vagus. Now, what is this vagus under the control of? It is under the control of few centers which are situated in the medulla, like the nucleus tractus solitarius, the dorsal motor nucleus. So from the nucleus tractus solitarius, okay, there will be impulses which reach the rostroventrolateral medulla, which contains vasomotor center. From there is either stimulation or inhibition of the vagus nerve, which hence will affect the heart rate. How is vagus going to affect the heart rate? You know that the vagus is supplying SA node. Now, at the end of vagus, there will be some release of neurotransmitter, which is that it is acetylcholine. So this acetylcholine, which is released at the nerve endings at the SA node, are going to decrease the rate of rhythm of SA node. SA node, and also it decreases the excitability of AV junctional fibers. I said that vagus is also going to supply few of the atrial fibers, isn't it? So it decreases the excitability of those junctional fibers, hence decreasing the transmission of cardiac impulse into the ventricles. Now, how is this acetylcholine, which is released at the nerve endings, going to affect the rate of rhythm of SA node? It increases the permeability of cardiac muscle fibers to potassium ions. Now, where is the potassium concentration higher? Its concentration is higher in the intracellular environment. So whenever the cell membrane permeability to potassium increases, the potassium moves from its higher concentration to lower, which means from inside the cell to outside the cell, making the intracellular resting membrane potential lower than normal, which is hyperpolarization, and hence the SA node will take a longer time to get excited. Hence, the rhythm is decreased by acetylcholine released at the end of vagus. So, therefore, the spontaneous depolarization is going to go lesser, and hence the time required for it to reach to the threshold levels is going to increase, resulting in the delay in the rate, meaning there's also a delay in the AV nodal excitability and the transmission to the ventricles, resulting in an increased of course there is a normal AV nodal delay, but it is going to increase because of that stimulation by parasympathetic. So you can see here the normal rhythm is the dashed lines, the red one is because of the parasympathetic stimulation. So you can see that the rate is decreased, right? So when does this happen? This happens whenever we are normally sitting and not performing any activity as such, so under the relaxed situations, it is parasympathetics which take over. Therefore, at rest, it is parasympathetics which take over the sympathetics to keep our heart rate in control. Then, what is the effect of sympathetics? Now, when we walk, or when we exercise, or when we run, you can see that your heart rate is increasing, isn't it? So you can feel it. That is called palpitations. How is that happening now? It is due to the sympathetic supply to the SA node, which gets activated following any kind of activity through the vasomotor centers. So that releases norepinephrine onto the SA node, which acts on the beta 1 adrenergic receptors, hence increasing the permeability of SA nodal fiber membranes to sodium and calcium ions, resulting in influx of sodium and calcium ions into the SA nodal fibers, resulting in the increased or faster updrift of the membrane potentials towards the threshold level, resulting in increased excitability of the SA node. Hence, the heart rate is increased by sympathetic stimulations. So you can see here, like for example, whenever you're under the emotional excitement or exercise, okay, it needs more blood flow, isn't it? That is the reason there is increase in heart rate. Okay, so if you can see here in the graph, the dashed lines represent the normal heart rate, whereas following sympathetic stimulation, like whenever you exercise or something, you can see the blue line which represents the heart rate, as is the pacemaker potential. Okay, the rate has been increased. The rate at which the SA node is getting excited is increasing, and hence heart rate also will increase. So if you consider at any given moment, like for example, now you're sitting and listening to the audio or the video, isn't it? So at this point of time, the heart rate will be maintained within the regular pace, and that is because at rest, the parasympathetics take over or they dominate the sympathetic activity because they release acetylcholine. This acetylcholine inhibits the release of norepinephrine. Later, when you're exercising or when you're speeding up your activities, that time there is excessive requirement of the blood flow to the extremities, which increases the sympathetic activity, hence decreasing parasympathetic. So this relative balance between the sympathetics and parasympathetics is very much important, and that is brought about or coordinated by cardiovascular control center. Where is this now? It is in the brainstem, that which I showed you earlier. So therefore, there is this cardiovascular control center which is situated in medulla. Whenever we are at rest, the parasympathetics through acetylcholine will activate the muscarinic receptors on the SA nodal cells, which will increase the potassium efflux, decrease the calcium influx, which hyperpolarizes the cellular membranes of SA node, which decreases the rate of depolarization, decreasing the heart rate. When we are exercising or performing any kind of activity, the physical activity, the beta 1 receptors of autorhythmic cells through the sympathetics, norepinephrine get activated, and that increases the sodium and calcium influx, that is the permeability of the sodium channels and calcium channels is increased, which causes the influx of the sodium and calcium ions into the cell, resulting in increasing the rate of depolarization, and hence heart rate is being increased. So there is reflex regulation of heart rate. The baroreceptor reflex, the chemoreceptor control of heart rate, and also the Cushing's reflex, the atrial stretch receptors and cardiopulmonary receptors. So how are all these going to affect the heart rate? First thing is the baroreceptor reflex activity. The baroreceptors, as we know, they are situated in the carotid sinus and aortic arch. So these baroreceptors, from the name baro is pressure. These receptors, which are situated in carotid sinus and the aortic arch, get stimulated following any alteration in the pressure. So these receptors are being supplied through the vagus nerve and glossopharyngeal nerve, which take their impulses to the brain stem, specifically to the nucleus tractus solitarius, which in turn affects the vasomotor center either through inhibitory neurotransmitter or excitatory, depending on the pressure change. For example, whenever the blood pressure increases, the baroreceptors get stimulated, and hence through the nucleus tractus solitarius. Now, what is the effect that we need is? The effect that we need is decrease in blood pressure, because the blood pressure is already increased. Therefore, through the GABA, it has to now decrease the blood pressure, right? So it will decrease the blood pressure through activation of parasympathetics. Now, whenever there is decrease in blood pressure, the carotid sinus and aortic arch, the baroreceptors do not get stimulated. So when they do not get stimulated, the nucleus tractus solitarius receives an impulse that baroreceptors are not stimulated. Therefore, through GABA, they are going to stimulate. GABA is an inhibitory neurotransmitter, but the vasomotor center gets stimulated because there is decrease in the blood pressure. Hence, it affects the intermediolateral horn. In the intermediolateral horn, that is specifically T1 to T4, there is preganglionic sympathetic neurons which will release acetylcholine, which will affect the postganglionic sympathetic neurons, which will be acting through norepinephrine on the SA node and also on the arterioles. On the SA node, it is going to cause increase in heart rate. On the arterioles, it is going to cause vasoconstriction. It is also going to act on the adrenal medulla. On the adrenal medulla, it is going to increase the adrenal hormones, that is the epinephrine and norepinephrine are going to increase, which in turn will increase the heart rate and blood pressure. So this I've already explained it to you. It is the same thing that which I explained just now. Next is the Cushing's reflex. So what is this Cushing's reflex and when does it get activated? So whenever there is gross hypotension, so what happens whenever there is decreased blood pressure? Whenever there is decreased blood pressure, the amount of blood that reaches the brain decreases. That is, the cardia is pumping at the low rate, the decrease in blood pressure, there is decrease in blood that which reaches the vasomotor center. So if the blood flow to the vasomotor center is decreasing, that in turn will activate the sympathetic activity so as to restore the blood flow back to normal, which in turn increases the blood pressure. So this increase in blood pressure because of the sympathetic activity is also along with increase in the intracranial tension. So whenever there is increase in the intracranial tension with the blood pressure all over, that will cause the reflex activation of baroreceptors, which causes the reflex bradycardia. This is called Cushing's reflex. Next, coming to atrial stretch receptors. Now, when does the atria stretch? The atria stretches whenever there is venous return. That is, the venous return will increase the capacity of the atria, and then hence the atria stretches. So the receptors which are present in the atria get stimulated because of the venous return. So that discharges during specifically the diastole because it is increasingly filling up. Hence, that activates the receptors which are called type B receptors, which are present in the atrial wall. These will increase the heart rate because there is filling of the atria, and that has to be pumped out into the ventricles and hence from the ventricles out, resulting in increase in heart rate. So we call this something called Bainbridge reflex, which is of not significant value. That is the reason we don't have to learn or understand it much here. Next are cardiopulmonary receptors. From the name, cardiopulmonary receptors, what do we understand? That which are present in cardia and few in the pulmonary area. Like the receptors situated in the endocardial surfaces of ventricles, which are activated during ventricular distension. So whenever the ventricles distend, okay, so that can cause vagal bradycardia and hypotension. So that is a reflex which is happening there. So we call a reflex which is happening because of the stimulation of cardiopulmonary receptors as basalt-Zarisch reflex, wherein the chemosensitive vagal C fibers, which are situated in the cardiopulmonary region, like for example, juxtacapillary region of alveoli, in the ventricles, in the atria, in the great veins, and also in the pulmonary artery, they cause profound bradycardia and they cause hypotension and a brief period of apnea followed by rapid shallow breathing. So all these we can see during myocardial ischemia. Okay, so these chemosensitive vagal C fibers get activated. That is, there is decrease. Maybe they're getting activated because of hypercapnia following myocardial ischemia. That is, the cardia is not functioning or pumping out properly, and hence it can activate the chemosensitive receptors present in cardiopulmonary region. So this will cause profound bradycardia, which is when called basalt-Zarisch reflex. Then there can be chemoreceptor reflex control. That is, chemoreceptor reflex, from the name we understand, it is happening either due to the alterations in partial pressures of oxygen or due to the partial pressures of carbon dioxide and pH. So as we know, the chemoreceptors are situated in the carotid and aortic bodies. So these chemoreceptors, whenever there is an alteration in the partial pressures of oxygen and partial pressures of carbon dioxide, will get activated. Hence, there will be an activation and alteration in the vagal nerve activity. So if there is a decrease, or the increase in partial pressures of carbon dioxide and pH, it is going to decrease the heart rate because of increased vagal nerve activity. Coming to hypoxia, hypoxia in turn is causing an opposite effect. That is, it is going to produce hyperpnea and it increases the catecholamine secretion. Of course, we know epinephrine and norepinephrine are going to cause tachycardia and increase in cardiac output. So it is a bit contrary that when hypoxia is causing increase in heart rate, but hypercapnia is causing decreasing in heart rate, and all these effects are specifically due to stimulations of different autonomic systems. Like for example, hypercapnia is stimulating vagal nerve, whereas hypoxia is stimulating the catecholamines. So coming to the Valsalva maneuver, the forced expiration against a closed glottis is called Valsalva maneuver. So this Valsalva manure, like for example, normally when does this happen? It happens during coughing, defecation, and heavy weightlifting. So whenever it is happening during these times, that is forced expiration against the closed glottis. So this straining increases the BP at the onset. So if the blood pressure is increasing on straining, it also increases intrathoracic pressure, which compresses the veins, that decreases the venous return. So whenever there is increase in intrathoracic pressure, it compresses the veins, which will decrease the venous return. So if the venous return is decreasing, then the filling, the ventricular end-diastolic volume will decrease. If end-diastolic volume decreases, cardiac output also decreases. Therefore, the systolic blood pressure also decreases. Now, when the blood pressure decreases, as we know, the baroreceptors get inhibited. That is, baroreceptors are not stimulated, which will now stimulate the vasomotor center, which will cause tachycardia and increase in peripheral resistance, hence increase in blood pressure. So this is during the Valsalva manure. Now, after the Valsalva manure gets over, what happens is the glottis gets opened. Now, when the glottis is open, the blood pressure is, the pressure is in the intrathoracic area is returning to normal. So, which means the the pressure which is acting on the veins also decreases. And hence, venous return is normal. Therefore, cardiac output also is restored. Therefore, resulting in everything back to normal. Okay, but so if the pressure is also returning back to normal, which will stimulate the baroreceptors, hence inhibiting vasomotor center. Therefore, the sympathetics are not stimulated anymore, causing bradycardia and a drop in pressure back to normal. So this is the effect of Valsalva manure. Now there are much higher centers. So till now we studied about the effects of the cardiovascular center, which is situated in the medulla, or specifically the brainstem. Now, can this be affected by any other higher center? Yes, they can be hypothalamus, they can be thalamus, they can be motor cortex, they can be limbic cortex. All these can also affect the heart rate. How? Now, as I said earlier, whenever we exercise, what is happening is the skeletal muscles are getting activated. There are proprioceptors in the skeletal muscle, which will take the impulses through the spinal cord to the sensory cortex. Now, from sensory cortex, it is being relayed to the motor cortex. And hence, from the descending tracts arising from the motor cortex to the spinal cord, there is going to be a relay of impulses to the brainstem. That means the vasomotor center also. Hence, activation of vasomotor center can activate sympathetics, resulting in an increase in the heart rate following exercise. Likewise, there can be other examples also. That is, the descending tracts from motor cortex to the vasomotor center situated in the medulla also gets impulses from limbic cortex and hypothalamus. So limbic cortex, what is its importance? Limbic cortex is specifically that which gets stimulated due to emotions. Like for example, you're angry on someone or you're excited about something. So in such cases, the impulses from the limbic cortex pass to the vasomotor center through the relay in hypothalamus. You know that the hypothalamus has got the autonomic centers, that is sympathetics and parasympathetics, through which again there is alteration in the heart rate. That is, the emotions, excitement and anxiety can cause increase in the blood pressure and also tachycardia. So this is the effect of motor cortex. So now, for example, whenever you have some pain, like say you have got a swelling in the hand or you got a burn during the stove, so that time there is increasing pain. That pain will increase the blood pressure. How is that happening? It is happening because the pain impulses are taken through the receptors situated in the skin to the spinal cord. Through the ascending tracts, it is going to the sensory cortex. From sensory cortex, it is being relayed. Also, it is while it passes through the from the spinal cord to through the medulla, it also relays few impulses to the rostroventrolateral medulla reticular formation. So this again will cause the stimulation of vasomotor center, increasing the heart rate and blood pressure. So again, there can be some hormonal regulation also. How the you know that the epinephrine or epinephrine which are released from the adrenal glands are also going to increase the heart rate because they are the ones which are acting through sympathetics, of course. Along with that, there is thyroxine specifically, which is also going to affect the SA node directly to increase the heart rate. Now, there are a few ions also which are of very much importance, which can control the heart rate because we know that the SA nodal excitability is under the control of calcium ions and potassium and sodium ions. Therefore, whenever there is an alteration in the potassium ions to the decreased potassium ions called hypokalemia, increase in potassium ions called hyperkalemia. Hyperkalemia is a very dangerous situation because whenever there is an increase in the EC of potassium concentration, it depolarizes the cell membrane partially, which causes the membrane potential to be less negative. Now, if this high EC of potassium concentration remains the same, what happens is now initially the membrane potential is being depolarized partially, but later membrane potential becomes highly unexcitable because of increased potassium outside, because it always remains the same inside and outside. Therefore, there's no alteration in the membrane potential, making it unexcitable. Hence, heart stops in diastole in hyperkalemia. Hence, there can be AV blocks, there can be ventricular arrhythmias. So all these effects can happen when the potassium increases, even to just the twice the normal level also. All these things can happen, which can ultimately lead to death. Therefore, hyperkalemia is a very dangerous situation. The opposite effects will happen in hypokalemia, right? So next is calcium ions. We know that the calcium is very important for the pacemaker potential and also for the ventricular action potential. So whenever there is excessive calcium in the ECF, what happens? The entry of calcium into the intracellular membranes of the muscle, cardiac muscle, and the SA nodal fibers increases. Therefore, there is increase in the heart rate. Later, the heart relaxes less because it has been contracting, it relaxes less. So if it is relaxing less, don't you think the diastolic duration decreases? If diastolic duration decreases, the EDP decreases. EDP decreases, cardiac output also decreases. So as this goes on, the heart goes on pumping without giving a gap. It stops in systole, which is called calcium rigor. Now, the opposite will happen when there is deficiency of calcium. That is, it causes cardiac flaccidity. Therefore, there is decrease in the heart rate. Now, there is temperature also. Like, for example, whenever you have fever and you go to a doctor, doctor checks the pulse rate. Why does the doctor check pulse rate? Because fever usually increases the heart rate. Now, why is the body temperature affecting heart rate now? Because the body temperature affects the calcium ion permeability. So that is, increase in the temperature increases the calcium permeability, resulting in increasing the entry or influx of the calcium ions into the cell, resulting in increasing the heart rate. Likewise, whenever the temperature decreases, like whenever you're in the cold regions, like whenever it is snowing around you, there will be decrease in the heart rate because there is decreased permeability of the calcium ions.